In this operating theatre in Diyang in China's southwest, a team of surgeons is battling to save the life of a local woman. The woman has a tumour on her right shoulder. Despite undergoing 3 operations to remove it, her shoulder hasn't healed and the tumour has kept growing. The team is led by Israeli surgeon Morris Topaz, considered one of the leading plastic surgeons in the field of wound closure. One of the Chinese surgeons who's been caring for the patient is Li Yongzhong.
Previously, we'd cut the tumor off from his shoulder, but this caused a hemorrhage. The wound was not healing, but the tumor kept growing.
Li first met Topaz in the aftermath of China's devastating Sichuan earthquake. Side by side, the pair battled to treat the thousands wounded in the quake. After seeing Topaz's talent firsthand, he asked him to lead the team which he hoped would finally help his long-suffering patient. Topaz's technique is called top closure, a surgical procedure known to reduce pain associated with operations and decrease wound healing time.
There is a good collaboration between China and Israel in this field, and I think that this can be implemented here in many applications for all kind of trauma cases, diabetic foot, all kind of complicated wounds. But putting together the vacuum technology and the top closure technology is actually very unique, because we can do things that, again, close big wounds in a very fast way, in a very simple way. We are expanding this. We are working in other hospitals, in military hospital in Beijing, in Xi'an, in Shanghai, in other places.
Chief of Plastic Surgery at Hillel Yaffe Medical Center in Hadara, Israel, Topaz honed his skills on the battlefields of the Middle East. It was these highly honed skills which helped treat victims of the quake, many of whom suffered large wounds prone to infection.
I was impressed when I met him in Sichuan. As soon as he arrived, he jumped into the shelter tents. He still had his luggage with him. After finding many of the patients required negative pressure wound therapy, and realizing that he could not carry out every procedure himself, he chaired a training course in our hospital, and so we began working together.
Since then, Topaz has helped establish 6 sister hospitals in China. In August 2009, he was presented with China's Friendship Award, which acknowledges the work of foreign experts.
I think that if we can change the way that we treat wounds in such a big country and spread it all over the world, this is a big achievement.